Biden, I call the honourable member for Bowman.
Yeah. Deputy Speaker, this is about people living in the bush. It's about the practitioners and providers that deliver world-class health services to one of the most sparsely populated places on the planet. And if you're in this chamber on either side, I know that you fundamentally support the great work that they do. But I tell you one thing about people from the bush: they know bulldust when they see it. They know talking point ping pong when they see it. And I tell you what they want. They just want us down here in Canberra fully focused, fully committed to better services in the bush. Now, after 6 years of Labor government, there was plenty of money spent, but not a lot of change on the ground. And I know we have just come to government with a very, very different focus, and that is to listen to those on the ground. We'll listen to the rural docs. We will listen to the rural health agencies that were here even last week, the rural health networks that tell us what people in the bush want. Now, as one of the truly sparse places on earth with the finest health system in the world, we need to listen to them and ask them how they do it and make their job easier. Nothing is achieved by screaming at each other down here in Canberra. It's the rural docs that have released Think Rural with 10 recommendations. I'll run through them very, very quickly. And the first of them is to sort out training for interns, registrars, house officers and medical students, and make sure that we provision for them. And it's the Coalition that put in $40 million over 4 years to get those internships funded when the Labor government of the last 6 years simply dithered at the challenge. We need specific ways of identifying, Deputy Speaker, the truly committed and impassioned health clinicians who want to be rural docs, identify them early and get them started. And of course we need an advanced rural training pathway, acknowledging that job as a doc in the bush is completely different to urban training. They do a completely different job, as many overseas trained doctors learn to their chagrin, and we need to have a specific training pathway for them. Of course, we need to know that overseas trained doctors, when they commit to this beautiful country, move to one of the most remote parts here and set up a practice, that their kids can go to a state school, that they still get coverage under Medicare, and that we look after these new citizens and respect them as equals, as they've been adjudged by the Medical Council, because they are just that. They are the backbone of rural service provision in so many areas where we can't get an Aussie-trained doctor to work. And of course we need to have the infrastructure. It's the general practitioners that will tell you in the bush they've got nowhere to accommodate the medical students. And that's why we need to have practice incentives, $238 million over 4 years, that actually partners up to do that, along with $52 million of coalition money directly dollar for dollar matching the commitments by rural practices. No, we're not having pop-up super clinics around the country right next door to existing general practice. We're doing it where general practices put in 50% of the amount. And lastly, what we want to see is some recognition of incentives to go bush. And if someone goes and commits to working out in Camberwell, they deserve a little bit more than someone who lives on the Queensland coast. Recognise those GPs that invest their lives in the bush. Now, Deputy Speaker, I just want to say thank you to the docs who head out there and do that great work. Thank you to the nurses who know their towns backwards. Thank you to the allied health practitioners who drive hundreds of kilometres every week delivering their expertise to communities that can't support a single professional with their skills. Thank you to those who take out their private health cover, who fund the system that builds the hospitals of the future, to the half of Australians who, because they can pay for their private health, they do just that. I want to say to the National Rural Health Alliance, thank you for coming down here, Gordon Gregory, and giving us your views, not just on the future of primary health networks, for which you understand can do the job, but also the importance of adequate NBN so that these practices can do their job. They can work in telehealth, so that the educational reforms that we are proposing will release more, not less, highly qualified health providers to the bush. I know that they are fully committed to dental services being delivered, and they're committed to seeing them delivered by private dentists, because we know that 98% of dentists work in the private sector, and no matter how much you have an aversion on the other side of the chamber to private services, if you don't have private dentists on board, it ain't going to happen. To those of the National Rural Health Alliance, thank you for putting your views so clearly. We could do far better spending this time in this chamber listening to those expert bodies, listening to Jenny Johnson, listening to Dr. O'Mara from Dr. Paul Mara from the rural docs, because they are the feet on the ground. They're looking after the local people. They know that those communities will support a small co-payment to keep the health system running effectively. They know the compassion of doctors is such that those who cannot afford to pay a co-payment will never be asked to do so.